Anxiety. Dictionary definitions. Anxiety disorder. A mental health disorder characterized by intense, excessive, and persistent worry and fear about everyday situations. Fear. An emotion caused by the belief that someone or something is dangerous, likely to cause pain or a threat. Phobia. An extreme or irrational fear or aversion to something. Panic attack. A sudden feeling of intense anxiety and fear that peaks with loss of control over one's emotions. Having occasional anxiety and worry is normal. We all experience this from time to time. Having a certain amount of anxiety is healthy, as it helps us to identify dangerous situations and avoid them. While having some amounts of anxiety can be typical, when people frequently have intense, excessive, and persistent worry and fear about everyday situations, this is when it is classified as an anxiety disorder. Feelings associated with anxiety disorders are difficult to control, interfere with daily activities, and are amplified to a higher level than the actual danger. When people have anxiety disorders, they can often have sudden episodes of feeling of intense anxiety, fear, or terror that can result in panic attacks within a matter of minutes. Common signs and symptoms of anxiety include trouble concentrating or thinking about anything other than their current worry or problem, having a sense of impending danger, panic, or doom, feeling nervous, restless, or tense, having an increased heart rate, breathing rapidly, hyperventilation, sweating, trembling, having trouble sleeping, experiencing gastrointestinal, GI problems, having the urge to avoid things that trigger anxiety. Some factors that may increase your risk of developing an anxiety disorder are stress buildup. This could be one larger stressful situation or a combination of smaller stressful situations. Trauma, personality, genetics or family history, other mental health disorders, drug or alcohol use or misuse or withdrawal. There are several different anxiety disorders, and it is possible for a person to have more than one. Some examples are generalized anxiety disorder, panic disorder, separation anxiety disorder, social anxiety disorder, and phobias. Generalized anxiety disorder is a mental health disorder that includes excessive worry, often about everyday issues, that is above any realistic potential threat. Panic disorder is a mental health disorder that includes repeated panic attacks or sudden feelings of intense anxiety and fear that peaks with loss of control over one's emotions. This can cause additional anxiety as a person may worry and avoid certain situations in which they have had panic attacks before. Separation anxiety disorder is a mental health disorder that refers to an exaggerated amount of anxiety created by excessive concern, worry, or dread of the separation or anticipated separation from a key figure. Social anxiety disorder is a mental health disorder that involves avoidance of social situations due to over self-consciousness about being judged, embarrassed, or negatively viewed by others. A phobia is a mental health disorder that is characterized by anxiety caused by being exposed to a specific object or situation, and therefore the urge to avoid it. There are many different types of phobias. Many people suffer from anxiety and anxiety disorders, and may need the help of a mental health professional to learn how to manage their symptoms and develop a system of support. In the case of an emergency, there are helplines that are available for you to call. Substance Abuse and Mental Health Services Administration, SAMHSA, has a national helpline in English and Spanish for individuals and family members facing mental and/or substance use disorders. The phone number is 1-800-662-HELP 4357. For people that are deaf or hard of hearing, there is a TTY phone number, which is 1-800-487-4889. In the U.S., call the National Suicide Prevention Lifeline at 1-800-273-TALK-8255 or use its web chat on suicidepreventionlifeline.org/chat. Building a system of support is important for all people and their general wellness and overall mental health. It's important to recognize that there are many things we can do to develop our own personal system of support. Some basic tools to use to maintain positive mental health include connecting with others, staying positive and practicing gratitude, meditating, being physically active, being of service to others, getting enough sleep, developing coping skills, getting professional help if you need it. In the song Relax, it says, "Relax and take it easy. Learn about what you love. Be open to what you might do. What's worthy of your time and your love." These are some basic things that we can think about to maintain positive mental health. Take a moment to relax and breathe. Think about things we are grateful for. Think about loved ones that you enjoy spending time with and help make you feel comfortable and validated. Think of things you can do to be of service to others that will make you feel a sense of purpose. Sometimes it can be beneficial to discuss these things with a mental health professional to process and guide you through your anxiety. Your worries may not go away on their own, so if you're experiencing anxiety and you feel overwhelmed with fear and worry, a mental health professional can help you to process these situations and feelings to manage your way through the anxiety. It may feel uncomfortable to reach out for help or experience our emotions, but both are normal, healthy, and necessary. Many people have gotten help to manage their anxiety and are able to live a healthy and good life. It is important to have empathy and be supportive of friends and family suffering from anxiety.